Hi everyone, this is Julia Schreiber from JPAL North America. Thanks very much for joining our webinar today. We'll go ahead and get started. We're really excited to be with you all today to share more information about our State and Local Innovation Initiative, which supports state and local governments in using randomized evaluations to inform important policy questions. As I said, my name is Julia Schreiber. I'm a Senior Policy Manager at JPAL North America, and I'm also the Initiative Manager for our State and Local Innovation Initiative. And I'm joined here today by Jessica Orozco, who's a Program Manager for the County of Santa Clara's Office of Supportive Housing, as well as by Jim Sullivan, a Professor of Economics at the University of Notre Dame and co-founder of the Wilson Sheehan Lab for Economic Opportunities. Jessica and Jim are partnering together on a randomized evaluation of a rapid rehousing program in Santa Clara County that they'll tell you all about in just a few minutes. But first I wanted to start with a quick look at the agenda for today's webinar. I'm going to start with an introduction to JPAL and our State and Local Innovation Initiative and discuss potential opportunities for using randomized evaluations to learn about the effectiveness of policies and programs. Then I'll turn it over to Jessica and Jim to share their experience partnering on an ongoing randomized evaluation. I'll close by sharing more information about how to participate in the initiative before opening it up to the Q&A. If you'd like to submit a question for the webinar, please feel free to enter it at any time using the chat box, which should be on the right side of your screen. I also wanted to note that we're going to be recording this webinar, and we'll post the recording and slides on our website in about a week, and that's povertyactionlab.org/state and local. I want to start by sharing some background on JPAL and why we launched the State and Local Innovation Initiative. JPAL is a research center that's based in the economics department at MIT, and our mission is to reduce poverty by ensuring that policy is informed by scientific evidence. And we do this through three core activities. The first is supporting evaluations of programs and policies aimed at alleviating poverty. The second is policy outreach, connecting policymakers with researchers who want to partner together on evaluations, and also working with policymakers to apply existing evidence from randomized evaluations to help inform their decision making. And the third is capacity building, helping people better produce, use, and advocate for rigorous evidence. And we do this both through JPAL's flagship executive education course, as well as through custom trainings. At the heart of JPAL is our network of more than 170 affiliated researchers who sit both at MIT and at other universities around the world. These affiliated researchers are independent academics who all have different research interests, but what they all have in common is their interest in using randomized evaluations as a tool to answer critical questions related to poverty. And at JPAL, we think about poverty very broadly. So you'll see on this map, each dot represents an ongoing or completed evaluation led by one or more of JPAL's affiliated professors. And these evaluations are across issues, including crime, education, health, and labor markets. And the work of our research network is supported by JPAL's professional staff, who sit both at JPAL's global headquarters as well as 6 regional offices across the world. I sit at JPAL North America, which is based in Cambridge at MIT in the economics department. JPAL North America launched the State and Local Innovation Initiative in the fall of 2015, and we were motivated by the understanding that many state and local governments are at the forefront of developing innovative approaches to address some of our nation's most challenging policy issues. But too often, state and local governments don't have the resources or the capacity to rigorously evaluate which of these approaches really work or which work best. So this is a sign that used to be on MIT's campus, and it's hopefully funny, but it also speaks to what we think is a real divide between the research community and government decision makers. There are many academic researchers who would be eager to partner with governments to help them evaluate their programs or help them apply existing evidence to their decision making. And on the other hand, many governments who would be eager to have pro bono support from academic researchers who have expertise in running and interpreting the results of evaluation. And yet these policymaker-researcher partnerships are far too rare, and too often they don't happen on their own. And so the goal of the JPAL State and Local Innovation Initiative is to help bridge this divide, and to bring together government leaders and academic researchers to partner together on high-quality and policy-relevant evaluations. And we do this by bringing together a package of resources. The first is that we provide matchmaking to help researchers and governments connect with each other. The second is technical assistance from JPAL staff who have expertise in both research and policy, and can serve as translators between these two groups. And the third is some flexible project funding to help get these early partnerships off the ground. But the goal of the J-PAL State and Local Innovation Initiative is not just to connect researchers with policymakers, but also to support a growing community of state and local leaders who are interested in using evidence-based policy to address issues related to poverty. And we do this by bringing policymakers together through trainings, convenings, and other events. So for example, the finalists selected through this initiative will be invited to come to Cambridge to participate in J-PAL's week-long executive education course. And through the initiative, we host annual convenings and other events to bring together policymakers along with researchers and other stakeholders to exchange ideas, to help problem solve common challenges, and to share evidence among jurisdictions, many of whom are facing similar challenges. To date, through this initiative, J-PAL has partnered with 13 state and local governments from across the U.S., and these state and local governments are working on evaluations across a wide range of issues. So for example, Baltimore, Maryland, King County, Washington, and Santa Clara County are all working to develop or carry out randomized evaluations related to homelessness, and we'll hear more about the evaluation in Santa Clara County in just a few minutes. Some other examples of evaluations that have been supported through this initiative include an evaluation of our Principals Training Academy in Puerto Rico and an evaluation of a summer jobs program in Philadelphia. So I mentioned earlier that at J-PAL, we focus on using randomized evaluations to study programs and policies. And so this J-PAL State and Local Innovation Initiative is specifically focused on supporting governments in developing and implementing randomized evaluations. But that doesn't mean that we think randomized evaluations are the only tool or even the best tool for answering important questions. Each of the boxes here represents, one method of impact evaluation, and there is a number of other methods that you can use to measure the impact of a program. And what the right tool is depends both on the circumstances of your program or policy, as well as the question that you want to answer. But first, to make sure we're all on the same page, I wanted to briefly describe what I mean when I say a randomized evaluation. So the key feature of a randomized evaluation is that before the program starts, eligible individuals are randomly assigned to one of two groups, the treatment group or the control group. And because of the random assignment, these two groups are statistically identical before the program starts. So we have a group of eligible individuals, or it can be another unit. In this case, we have houses. Those groups, those eligible households are divided into two groups. The treatment group receives access to the program, and the control group does not. The two groups continue to be identical. The only difference is that the treatment group had access to the treatment of the program, and therefore any differences in outcomes that we measure after between the two groups can be attributed to the treatment. Or in other words, compared to other methods of impact evaluation, when we run a randomized evaluation, we can be very confident that any difference we measure after the program was caused by the program and not by some other factors. Now, of course, this is just a simplified example, and there are many other ways to design a randomized evaluation. And Jessica and Jim will talk a bit about how they designed the randomized evaluation of the rapid rehousing program. And these different design choices can be made to make sure that we're both answering an important question, but also designing the evaluation in a way that has a minimal impact on how a program operates. I'm happy to answer some questions about that during the Q&A. Here at J-PAL, throughout the application process, or even if you're just interested in learning more about randomized evaluations, we're happy to talk to you about what a good opportunity might be, or to talk through a specific program or policy that you have in mind, and whether or not that would be a good fit for a randomized evaluation. But I wanted to briefly run through a few opportunities to look out for. And the first is when you're running a pilot program, and building in a randomized evaluation can help inform decisions about whether or not to continue the program after the pilot. When a program or service is oversubscribed, or you have more eligible individuals than you can serve, random assignment can be a fair way to allocate spots in the program and then also enable a really rigorous evaluation. When you're expanding to a new service area or target population, random assignment can be a way to decide where to expand first. And when you're adding a new component or service to an existing program, you can randomize which participants receive the new component or service first, which also allows you to test which version of the program is most effective, for example, by comparing version A of the program to version B. And finally, if you're considering changes to program eligibility thresholds or cutoffs, you can randomly admit individuals who are just below or just above the cutoff, And that allows you to test whether the program is equally effective for this new group. At JPAL, one of our goals also is to help advise folks when a randomized evaluation does not make sense or isn't the right fit, either for the question that they want to answer or for the program or policy that they have in mind. And here are just a few common cases when a randomized evaluation does not make sense. And the first is when it's too small. So oftentimes, the first question that you'll hear if you're talking to a JPAL staff member or to a potential research partner is what the sample size is for a potential evaluation. And by sample size, I mean the total number of individuals or other units who could be in both the treatment and control group for a potential evaluation. If the sample size is too small, then you're not able to detect meaningful differences in outcomes between the two groups, and it doesn't make sense to do a randomized evaluation. It's really hard to give a specific number because the necessary sample size for an evaluation depends on a number of different factors, but typically randomized evaluations have sample sizes in the hundreds, and in some cases even the thousands. Another case when a randomized evaluation might not make sense is when it's too early and you're still ironing out the logistics. If the evaluation finds that the program has no impact, is that because the implementation details just hadn't been worked out yet, or because that program or policy would never be effective? And if you don't know which of those outcomes it is, then it might not make sense to pursue a randomized evaluation. You also can't do a randomized evaluation when it's too late, meaning that you've already served everyone who is eligible and no randomized assignment was built in from the start. It's not possible to go back and build in random assignment after the fact. And finally, when a positive impact has been proven and we have the resources to serve everyone, we should invest any further time and resources in scaling up the program, making sure that it's continuing to be implemented in the way that is intended and that it's reaching as many people as possible. And at JPAL, we would certainly never advise undertaking an evaluation just for the sake of evaluation if it's not going to inform an important policy decision. Great. So with that in mind, I'm going to turn it over to Jessica and Jim so they can tell you about a specific example of a randomized evaluation in practice. And again, this evaluation is taking place in Santa Clara County, California. As a reminder, Jessica Orozco is a program manager for the County of Santa Clara's Office of Supportive Housing. And Jim Sullivan is a professor of economics at the University of Notre Dame and a co-founder of the Wilson Cheehan Lab for Economic Opportunities. So Jim and some of his colleagues at the Lab for Economic Opportunities, or LEO, are partnering with the folks in Santa Clara County to implement this evaluation.
Good morning, everyone. Thank you for having us present. I'm hopefully going to be able to give you guys a brief overview of what our housing system looks in Santa Clara County and some of the reasons why we decided that we wanted to have this partnership in order to evaluate our programs and make sure that we are serving our community in the best way possible. So really our mission here at the County of Santa Clara and at the Office of Supportive Housing is to make sure that we are ending homelessness. And what this means to us is that we want to make sure that homelessness is prevented whenever it's possible and that otherwise it is brief, rare, and non-recurring. To give you guys just a general view of what our county looks like compared to other metro areas, based on the 2016 point-in-time homeless census count, we were the 7th largest homeless population at any given night. What this meant that it was that at any given night we had over 7,500 individuals unsheltered sleeping on the streets. Based on this same point-in-time count, we have the highest rate of unsheltered homeless individuals, the 4th largest number of homeless individuals, the 3rd largest chronically homeless population. And what this means is that the individuals who are chronically homeless are long-term homeless individuals with disabling conditions that won't allow them to become self-sufficient through employment. And so these are just some of the statistics that we are dealing with here in Santa Clara County. In addition to the large numbers of our homeless individuals, we have very small rental market. It's very expensive. And so we have a lot of different components that makes it very challenging for us to end homelessness. I wanted to discuss a little bit about our system components. This is pretty much how our office, in a sense, is laid out and how we are tackling homelessness. We have our homelessness prevention system, which means before an individual or family becomes homeless, if they're at risk, we have services to support them. We have some traditional housing opportunities. We have rapid rehousing, which is what we will focus on today, and permanent supportive housing for those chronically homeless individuals that I just mentioned. On the other side, we also have our development team and our subsidy team. So really what this means is the actual building of affordable housing and the partnerships with long-term subsidies that can continue to operate services in our permanent housing opportunity developments. So really with our system components, what we want to make sure is that we are increasing our housing production, but what this means to us is that in order to do that, we need to make sure that we are organizing our community, that we are funding our services and our developments, and that we're able to deliver and sustain services in our community. Of course, this is all predicated also on our ability to overcome the fear and anxiety that sometimes fuels the community, that is truthfully just based on some stigma and discrimination against those with mental illness. So even if we had all of these system components working really well together, we still really at a community level need to make sure that we are informing our community of what we are planning to do and try to really confront the stigma and discrimination, because there are times where we might have good partnerships, but the community itself maybe doesn't want an affordable housing development in their community because they feel that this will impact the value of their homes, et cetera. So these are just some of the different areas that we try to tackle. For rapid rehousing, rapid rehousing is a time-limited rental subsidy that we use to quickly move families and individuals into housing. Short-term in our county can mean anything from 6 months to up to 2 years. They vary depending on the population that in the program. And with rapid rehousing, what the individual or family will receive is financial assistance and supportive services. The supportive services can include anything like, we call it case management, but connection to benefits, connection to healthcare, behavioral health, substance use, employment, vocational training. It really is meant to do anything that the family or the individual needs in order to self-sustain. And we are a housing first community, and what this means is that we will house people first because we feel that that is the best and first treatment, and from there we will work on any other barriers that the family has. What this really means is that it's a disruption of an old model where housing used to be used kind of as that carrot for the individual or family. So in the past, for example, a family would be able to be enrolled and possibly housed once they became sober. We disrupted that, and really we're saying in order for a person to be able to focus on sobriety, they need to be housed. They need to have the safety of housing, and then everything else will follow. And so far, our data shows that from the clients that have exited rapid rehousing in 2017, 70% of those obtained permanent housing. Our goal as a community is a little bit higher, so we're hoping to increase this with more resources also. Just wanted to highlight some of our accomplishments. We have a lot of need, and we definitely do not have all of the resources in order to meet that need. But from 2015, which is when our office really was established and we established our coordinated entry system, since then we've helped over 6,000 individuals obtain or maintain their housing. This includes over 1,300 veterans. We've increased our permanent supportive housing by 50%. Permanent supportive housing meaning long-term subsidies for chronically homeless individuals. And we've increased our rapid rehousing capacity by 50%. We've also created a homelessness prevention system that is serving over 490 families per year. And because our community or our county was able to pass the 2016 Measure A bond, what this meant is that we are able to commit over $234 million so far to 19 projects in 6 different cities. So what this means is that we're able to develop, or so far we've been able to develop over 1,900 apartments, and close to 1,000 of those are going to be supportive housing. We also have at least 1,500 more that are in the pipeline, And so this are just some of the things that we've been working really hard since 2015. And again, even though we've made great progress, we still have a long ways to go. So our strategies, I just mentioned some of those, is really to disrupt the systems. We want to make sure that what the old way was of serving individuals, if it's not working, we want to create new ways. Through that, we created our coordinated assessment. We've created landlord incentives that we initially focused on veterans, and it very much helped us decrease homelessness in veterans. And we are partnering together very closely with local jurisdictions. So different cities, for example, we've released RFPs or proposals that are in partnership with the City of San Jose, the County of Santa Clara, as well as the Housing Authority. So really working really well together with the cities so that perhaps they could fund some services and then the county will match them with subsidies. So really trying to leverage our resources while building the solution and ultimately serving the person. And I'll just give you just some brief numbers about how we've been measuring our impact of services. So as I mentioned, we've housed, this slide is a little bit older, but we've housed now over 6,000 individuals. And as you guys can see, from 2015, we started with about 1,200 people. And so, again, great progress, but we have a long way to go. There are about 90% of individuals remain stably housed for at least 12 months after they've been housed through our subsidies. So what we like to measure is our housing retention at the 6-month mark, at the 12-month mark, as well as the 2-year mark, just to get an idea of what's working and how do we continue building on the programs that are. And one of the things that I did want to include is how many people return to homelessness after those benchmarks that I mentioned. Currently, we're at about 7%. We'd like to get that number lower, but we want to make sure that in order to decrease this number, we are applying the correct strategies. And it varies also, the returns to homelessness, whether people were housed from emergency shelters, from transitional housing, or for permanent supportive housing systems. And Jim will talk a little bit more in detail about our partnership, but the idea was that we wanted to make sure that we are doing more of what's actually working. We want to make sure that as we are obtaining more resources, that we're using them in the best way possible, and we really want to make sure, do our programs actually work? What parts do they work? What parts maybe need to be shifted? So the more that we create programs, we create the best serving programs, which is one of the reasons why we wanted to partner in order to evaluate one of our rapid rehousing programs. It has been definitely great, but also challenging. One of the challenges that we faced really was integrating various county departments. And so what we wanted to do was not just look at the programs that we establish and are those working, but how are the folks that we're serving connected to other services, and how is that impacting those services as well? And so in order to do that, we needed to have the buy-in of various departments, including the health and hospital system, our behavioral health system, our criminal justice system, and all of these different systems just created a little bit of challenges because of the different rules on confidentiality and data and how we obtain those, the costs, and all of that together. So these challenges actually ended up delaying the start date of our study and program. However, we were able to work through it and are going to continue to make things easier so that in the future, when we are either creating programs to serve individuals or trying to do other types of studies to improve what we do, that we don't have as many challenges. But as with any government agency, we do deal with different levels of bureaucracy, and this was definitely one of the times where we had to regularly meet with different departments and advise them of why we were doing this research, how it would benefit us. Of course, our partners at LEO were fantastic, coming to different meetings and talks so that they could explain exactly what they're doing and what we hope to get out of this. So though it was challenges and it created some delays, we have since then started and are very much looking forward to the outcomes of the study. And if you guys would like more information about Santa Clara County specifically, that is our website. We have information on our Measure A bond. We have information on our different programs, what our continuum of care and coordinated assessment looks like, and other statistics in general about everything to do with homelessness in our county, including demographic information. So I will now turn it over to Jim.
Thank you, Jessica, and thanks to JPAL for inviting me to be part of this webinar. I am very excited to be part of this because this is a really exciting project that has really evolved as a result of a partnership of many players and all who contributed to the success of the project. So I am co-founder of the Wilson Sheehan Lab for Economic Opportunities, which is located here at Notre Dame, but is a research center where we partner with local nonprofit agencies and state government and county agencies to measure the impact of their domestic anti-poverty programs. And we collaborate with government agencies and nonprofits all across the country. And given our shared mission, it's not surprising that we have collaborated on many of these projects with JPAL. Several years ago, I had the good fortune of meeting Jessica and her team at the Office of Supportive Housing in Santa Clara, and they shared kind of an interest with Leo in rigorously measuring the impact of their programs so that they could make better decisions about which programs to implement to best help the vulnerable populations that they serve. And over a series of conversations, we identified a program that was a particularly good fit for a randomized controlled trial evaluation. As Julia mentioned, not all programs are a good fit, but the rollout of this rapid rehousing program was a nice fit. I should also mention that the nonprofit that's involved in this partnership, Home First, is the agency that is providing the services on the front line. So they're working with the county to identify the eligible population and then provide the rapid rehousing services. Really from the beginning, JPAL has been involved in this project. They have provided critical technical support all along the way, and they even have associates in the area who have provided site visits, and then going forward, they'll play a key role in helping us network with other projects that are measuring the impact of housing programs and ultimately to disseminate this evidence so that it has an impact on how housing programs are implemented all across the country. So I wanted to start by telling you a little bit about who this program is serving in particular. So I'll talk a little bit about the eligibility for this rapid rehousing program. And it's really important when you start a study to have a clearly defined eligible population. First, that's important because you want to ensure that population well exceeds the number of people that you can serve. In other words, that there is excess demand for those services, because that allows you, provides a situation where because you are not going to be able to serve everybody who satisfies the eligibility criteria, you can give everybody an equal opportunity to have access to it, and those that are selected not to have access can serve as a control group to provide information in the way Julia described of what would happen if they did not receive services. So we started off the study by defining clearly what the eligibility criteria were. And this is also important because when we go to think about for whom is this generalizable to, and we want to replicate this program elsewhere, it's important to be able to describe who this program served so that other communities can understand that the evidence demonstrates the impact of the project for a particular population. And in our case, the eligibility for this specific type of rapid rehousing program was that the individuals were homeless at the time of enrollment, that they were single adults, and all of the potential study participants would go through a VI-SPDAT assessment. So think of that as a risk assessment for homelessness, and they would come up with a score, and those that had a score in the range of 4 to 7 in the VI-SPDAT would qualify for rapid rehousing. Now that was the rules in Santa Clara County in absence of the study, so we didn't change those rules. Those that had a higher risk score would be eligible for other programs like permanent supportive housing. But we focused in on the set of individuals who would be eligible for rapid rehousing, and then we would choose from them in terms of who would participate in the services. I should mention that as Jessica noted, that there's many. It's a much broader set of services that are provided, even broader set of rapid rehousing services. So they do provide rapid rehousing for families, but our study is focusing on single adults. When we worked with the county to identify how many people are potentially eligible for this rapid rehousing program, it included over 2,000 potentially eligible individuals. So it was clear there was excess demand. Far more individuals were eligible for this program than the county could in the short run serve, or that Home First could enroll in the program. So that's kind of the first step in laying out the design of the study. And then I want to talk to you about how we actually did the enrollment for the study. So we start by working with the county to identify the eligible population. And so as I mentioned, it was single homeless individuals with a VI-SPDAT between 4 and 7. There were more than 2,000 that satisfied that criteria. And then this figure you're looking at really just shows one branch of the enrollment process, because what we did is I'm showing it to you for one particular VI-SPDAT score, but we did this separately for each VI-SPDAT. So in other words, if an individual who was potentially eligible was scored a 4 on the VI-SPDAT, then all those 4s were grouped together, and we selected from that group who would be part of the study. And then we did that separately for those who scored a 5, and then scored a 6, and scored a 7, so that our study ultimately would have approximately an equal number of each VI-SPDAT score group in the study. And ultimately, we want to use that information to shed some light on whether or not rapid rehousing is particularly effective for people with relatively high risk or relatively low risk at baseline. So the county shares this list of individuals who are potentially eligible for rapid rehousing. They have it prioritized based on their criteria, and one of which is how long that they've been on the list, and they send over a longer list of individuals to Home First, and the case managers at Home First use that list to track down the eligible population. And that probably is the most time-intensive part of this intervention. But in providing this service, they would have to do that tracking down whether or not there was an RCT component to the intervention. It turns out that it can be challenging to track down this population because they're homeless. The case managers are well experienced with working with this population, and they work with the network of homeless and homelessness prevention services to locate these individuals. And then once they locate them, they start the process of enrolling them into the study. And that process works as follows. So the case manager has a tablet that has the enrollment survey, and they start by just screening for eligibility, making sure that their eligibility status hasn't changed. And then if the candidate remains eligible, they're asked whether or not they would be interested in participating in this program, where they would have access to rapid rehousing. They're explained that it is in the context of a study, and then they're asked to consent to participate in the research study. And once all of that has been approved, the intake form on the tablet will automatically randomize to determine whether or not those who are eligible and interested are either offered rapid rehousing or assigned to the control group. And I should be clear here that those that are assigned to the control group are informed about the other services that are available in the county. Essentially, they have access to all the other services that they would have in absence of this study. So the study does not prevent anybody from having access to pre-existing services to help them become more stably housed. It's also important to note that not everybody who's offered rapid rehousing will take up the services. Some people, when told that they have access to these services, will, in a short period of time, maybe find access to housing in another way, or for other reasons don't participate. So some ultimately are not enrolled in rapid rehousing because they decline. In this kind of study, because of the screening we do in advance, nearly everybody who is offered rapid rehousing will enroll in the program and seek the assistance to get housing. Ultimately, what we're after is a treatment group of 360 individuals and a control group of the same size. As Julia mentioned, these impact evaluations, randomized controlled trials, need to have a substantial sample in order to be able to say precisely what the impact of the program is. And so that is that's our target study sample. And let me talk you through a little bit of the timeline so I can tell you how much progress we've made along these lines. I should mention that, so the treatment group of 360, there'll be equal size of each of the VI-SPDAT scores. So we're aiming to have about 90 in each score group when we enroll them. And the same goes for the control group. In terms of the timeline, so we started enrollment in July of this past year, and it started off a little slow because, you know, we had just a couple of case managers working on this, and then we've expanded the number of case managers that are tasked with these responsibilities. There's a little bit of learning by doing on how best to track down these individuals and enroll them in the program. But we're excited that we've already enrolled over 100 individuals into the study. More than 50 are already in treatment. And our goal for each year would be to enroll 240, and we're going to do this over the course of 3 years. There'll be 240 in the combined treatment and control. And so we feel like we're on track to complete the 1 year first cohort enrollment by July of 2019. And then what we've laid out for the study is when are we going to analyze the outcomes. And so I put this timeline here to help you kind of get a sense of the evolution of a study like this. And so, for example, because it takes a year to enroll individuals, and then we want to look at the impact on key outcomes 1 year later, we will do an assessment of 1 year outcomes in the fall of the late summer, early fall of 2020. And that will be just for the first cohort, the cohort that's enrolled between July of 2018 and July of 2019. A year after that, we will provide 2 year outcomes for the first cohort, and then 1 year outcomes for the second cohort that will be enrolled between July of 2019 and July of 2020. And then following that same pattern, in late summer, early fall of 2022, we'll have 2 year outcomes for cohort 2, 1 year outcomes for cohort 3. We would also have 3 year outcomes for cohort 1 at that point, but we will provide 3 year outcomes ultimately for all participants by by the September of 2023. And there's 2 points that I want to make clear with this timeline. The first is, as you probably gathered from this, is you have to be patient, right? So there's 2 reasons why this RCT is going to take a considerable amount of time. One is that we have to enroll individuals over a long period of time in order to get to a sample size that will be sufficient to measure the impact precisely. And the other is just that it takes a while to provide these services, get these individuals housed, and then for additional time to elapse for it to be interesting to observe key outcomes. And I'm going to talk about those outcomes, what those key outcomes are in a second. The other point that I want to make is that even though it takes a long time to complete the study, there will be lots of opportunity to learn along the way, to provide early evidence of what's working and what's not working, and that I think alone will be informative to the county and to policymakers and to the service provider community. So just in terms of outcomes, let me talk a little bit about what we're going to measure. And I should highlight that each of these outcomes are provided through administrative data. We're not going to administer surveys to try and track this population down. That would be prohibitively expensive, and it oftentimes is difficult to track down individuals in both the treatment and control group. We fortunately have lots of information on important outcomes through administrative data. So through the HMIS system, the Homelessness Management Information System in Santa Clara, we observe whether or not they check into a homeless shelter. We can measure this at various points in time after the initial enrollment to see whether or not rapid rehousing ultimately prevents unstable housing situations or homelessness, which would be a key goal of the program. We also have consumer reference data that tracks changes in address, and that information would allow us to determine how frequently these individuals move, to provide additional evidence on housing stability. Are they able to stay in their residence, or are they, having to move in with family and friends, or moving frequently because they don't have a stable living situation? And so we'll have additional information on that. Through health system records that the county is connecting us with, we will be able to observe whether or not they check into the emergency department or have hospital admissions we know that those outcomes are strongly correlated with homelessness. And so one goal of this program with stable housing would be to reduce their visits to the hospital, improve health outcomes generally for this population. We also know that arrests and incarcerations are strongly correlated with homelessness. And so an important outcome here would be whether they're arrested, they go to court, and ultimately are incarcerated. We will get information on that from the Criminal Justice Information Control in Santa Clara County. The county also has access to use of government benefits, and so we'll be able to measure 1 to 3 years after enrollment into the program whether or not they are participating more or less in government programs. And ultimately, we are hopeful that we will also be able to link the study participants to state unemployment insurance records, which will give us information on employment and earnings to see whether or not this intervention is improving labor market outcomes for this vulnerable population. So before I turn it back over to Julia, I just wanted to share with you a few early lessons learned from what we've done so far after we've enrolled more than 100 participants into the study. I already mentioned that tracking down homeless individuals is difficult. That I think is something that we've learned it's critically important to have a partner who has a lot of experience working with this population. So Home First has done a lot of work providing services to this vulnerable population, and they have developed great strategies for tracking these individuals down, articulating the importance of the study and the benefits of participating in the program, and then helping to enroll them into the study. We also, this is relevant really for virtually every RCT, is that ultimately some group is going to be told that they're not going to have access to the services. This can be challenging information to convey, both for the potential participant, but also for the case managers who have to relay that information. So we have worked a fair amount with the team at Home First on how we articulate this information. It certainly has been helpful for them to understand a couple of key things, like not everybody would be served even in the absence of this intervention, and that the control group will have access to all the services that it could have before. And in fact, because of the study and because we're reaching out to these individuals, the control group might have more access to information on pre-existing services than they would otherwise. So it helps disseminate that information to this at-risk group. It's also important for the case managers to understand how important this information really is in terms of improving outcomes for this population, because if the evidence is encouraging and promising, that will help steer additional resources and attention to these programs, which would hopefully expand the capacity and allow these programs to serve the broader population. And I think that actually Home First has done a remarkably good job at getting buy-in from the whole team in terms of participating in the randomized controlled trial and understanding its importance. And the last point I'll make is that the partnership between the researcher and the provider is really important for the success of the randomized controlled trial. So we have biweekly calls with the research team and the team at the county, the Office of Supportive Housing, as well as at Home First. And this has helped us to ensure that the enrollment process goes as smoothly as possible. When random things happen, like a tablet breaks down that is used for enrollment, or at one point it lost connection to the internet, which we needed for the randomization process, we were able to debug that process. Those things work really well when we are in regular contact with the team. And I'll leave it at that and look forward to any questions you might have about partnering on a randomized controlled trial evaluation. With that, I'll turn it back over to Julia.
Great. Thank you so much, Jessica and Jim. I'm going to talk now just for a few minutes about how state and local governments who are interested in participating in this initiative can apply, and then we'll turn it over to the Q&A. As a reminder, if you'd like to ask a question for me or for Jessica and Jim, please feel free to enter it at any time using the chat box. We'll try to get to as many questions as possible before the end of the webinar. So as many of you may know, the JPAL State and Local Innovation Initiative offers funding for project development grants, for pilots, and for full evaluations. And this webinar is focused especially on our request for letters of interest, which is open now, through which state and local governments can apply for these project development awards. And this includes matchmaking with JPAL's network of researchers. So based on the question that you're interested in, we can help connect you with research partners like Jim or others in our network who could be good partners on an evaluation. We provide up to 1 year of technical support from JPAL staff, who can provide a host of supports to help get these early partnerships formed and get the research projects off the ground, including project management support, training and capacity building, as well as support with specific research activities. And then we also provide flexible project development funding of up to $50,000, which state and local governments can use to help cover the initial costs of these research government partnerships. So for example, paying for part of the staff time for a project manager within the government who's going to manage this engagement. And then we also host a separate request for proposals for state and local governments that have partnered with a researcher from JPAL's network and who are ready for additional funding to carry out the evaluation, so either a pilot evaluation or a full evaluation. And as I mentioned, we're now inviting letters of interest from interested state and local governments. The application is pretty simple. We just ask that you submit a 3- to 5-page letter of interest that describes your office or agency and what you do, one or more policy questions or challenges that have motivated you to apply, what the opportunity, or in some cases the opportunities might be for randomized evaluation, and how you're going to use the evidence that's generated from this evaluation or from elsewhere to inform decision making. If you want more details on the application process, you can visit our website and download the instructions there. I also wanted to mention that JPAL staff are here to help throughout the application process. Our staff are not members of the review board that make application decisions, and we can work with prospective applicants to help you prepare stronger applications or sort through potential questions that might be a good fit for an evaluation. If you'd like to take advantage of this, please feel free to reach out to our staff, and in particular, Kim Dadisman, a policy and research manager at JPAL, whose email is here, is available to schedule 30-minute phone consultations with prospective applicants to help walk through their potential proposals and provide feedback and advice on the process. In terms of the timeline, the next key step is the deadline for letters of interest, which is April 1st of this year. And then a small number of finalists will be selected and invited to submit full proposals. These finalists will also be invited to come to Cambridge to attend JPAL's executive education course, which is called Evaluating Social Programs. And it's something like a one-week randomized evaluation boot camp to help cover some of the key steps in designing and then carrying out a randomized evaluation. And finalists will also receive some additional support from JPAL and from our network of researchers to help them further refine their evaluation questions and their proposals. Full proposals will be due in August, and then winners announced the first week in September. Great. So we're going to open it up now to the Q&A. As I mentioned, if you would like to submit a question, please feel free to submit it using the chat box, which is on the side of your screen. We'll do our best to get to a few questions before we close. If we don't have time to get your question answered, please feel free to reach out to me. My contact information will be on the last slide, and it's also available on our website. And again, as I mentioned, we'll go ahead and post the recording of this webinar and the slides on our website probably by the end of next week. So one question that we often get that I can start by answering is what kinds of governments can apply to this initiative? So this initiative is open to U.S. state and local governments, and we define state and local governments very broadly. So applicants can include city, county, and state governments. We also invite applications from school boards, health departments, and also coalitions of governments who are working with nonprofits. So in the example that Jessica and Jim shared, as I mentioned, the County of Santa Clara is working with a local provider, Home First, that's actually implementing the programs. That's totally fine, as long as there's a state and local government that's identified in your proposal. And Jim and Jessica, I have a question that I'm hoping you can answer. You talked a bit about the importance of building buy-in among Home First and the service provider, and also, some of the challenges of working within the county and the bureaucracy, and in particular around sharing data. I'm wondering if you could both speak a bit more to how you helped build buy-in and support for the evaluation from all of those different stakeholders.
I'm happy to comment on that. There are a couple of factors that make buy-in much easier, and perhaps the biggest is that there's buy-in from the top. So when we partnered with Santa Clara County, the Office of Supportive Housing, it runs deep throughout their office this interest in evidence and understanding that it can improve the work that they do. And so that played a really important role. And then when we partnered with Home First, we had them in on the conversations from the very beginning. The research team went to Santa Clara. The members of JPAL were at that meeting where we sat with the folks from the county as well as the folks from Home First, and we talked through how we might design the intervention. And that proved to be hugely important because the Home First folks were able to say at certain points, no, this is not going to work, and yes, this will work. And so we were able, when we came up with the research design, in the end, it was the input from Home First was critically important. And because they felt like they had that buy-in and they had that ability to contribute to it, they were much more committed to the program. But really the support from the county along with the buy-in from the leadership at Home First has made it much easier for all the case managers to get on board and be part of and excited about this evaluation.
Great. So one other question is, what is JPAL looking for in a potential proposal? So I think there's a few things that are common among successful proposals, and the first is a commitment from leadership within the state or local government to using evidence to inform decision making. So we want to make sure that if we're supporting an evaluation, that it actually has the potential to inform an important policy question. The second, of course, is a question is well suited to a randomized evaluation. So not every question is a good fit for being answered for a randomized evaluation, and as part of the application process, will help applicants think through whether their question is a good fit for the kind of work that we do. And the third is a willingness to think creatively and work collaboratively with JPAL and the researchers in our network to design a randomized evaluation. So, as Jim and Jessica shared in their example earlier, there's of course always some challenges in terms of, rolling out an evaluation of an ongoing or even a new program, and researchers and JPAL will work with you to help minimize the impact of the evaluation on your program or policy, but sometimes that requires creativity on both sides to make sure both that the program isn't negatively impacted, but also that the evaluation is of high quality. Great. One other question is whether a government can apply if they already have a research partner. And the answer is yes, if you have a research partner, you are welcome to apply. That being said, we're looking at applicants who are interested in participating in the full range of services and supports that JPAL offers, which includes potentially connecting with other research partners if there's other opportunities for evaluation that you'd like to pursue, receiving technical support from JPAL staff, and also the flexible project development funding. If you're interested just in funding for an evaluation that you've already designed, then this evaluation probably isn't the right fit. And if you're not sure and want to talk more, again, please feel free to reach out to me or to other JPAL staff, and we can help think through whether this initiative is a good fit for your particular circumstance. We're nearing the end of our time, so with that, I'm going to close. If you'd like more information, I'd encourage you to visit our website, which is shown here. It's www.povertyactionlab.org/state and local, and there you can find the application instructions for our request for letters of interest. And I also wanted to point towards two specific resources. So the first is a guide that JPAL put out called Using Administrative Data for Randomized Evaluations. As Jim mentioned when he was talking about the Santa Clara project, one thing that can make randomized evaluations more feasible and also more cost-effective is being able to use existing administrative data to measure outcomes as opposed to collecting new data using surveys. And so this guide provides some background information on administrative data and how it can be used to enable a randomized evaluation. And then I also wanted to highlight our guide to implementing randomized evaluations in government, which shares case studies from the first 5 governments that were selected through this initiative, as well as covering some topics that might be useful to prospective applicants or others who are considering pursuing a randomized evaluation. So with that, thank you again to Jim and Jessica, and thank you all for being with us here today. If you have any questions, my email address is here. Please feel free to reach out, and we're happy to talk more. And as I mentioned, we'll follow up to share the slides and the recording of this webinar if you'd like to share that with any of your colleagues. So thank you again, and have a great day.